How to read Beta HCG result. Friends, I have explained this before, but let me explain it a little more briefly. For example, sometimes the HCG result comes out as 0.5 or 1.2. You have questions like, what is this? Am I pregnant? Now, in this video you will understand this. I will summarize. First, let's briefly explain what Beta HCG is, friends. If pregnancy occurs, the placenta begins to produce a hormone called HCG. As you know, the placenta only forms during pregnancy. Therefore, we can look at this hormone and understand whether there is a pregnancy or not. Now, normally if fertilization occurs, this HCG rises to measurable levels in the blood approximately 11 days after fertilization. So, let's say you had a blood test. It can be detected in the blood 11 days after fertilization, that is, when your period is late. It is detected in the urine a little later, approximately 12 to 14 days later, if pregnancy occurs. HCG level constantly increases in the blood, reaching the highest level after 8 to 12 weeks of pregnancy, that is, approximately 3 months later. Now, let's say you get tested, HCG doubles approximately every 2 to 3 days. Look, here are the approximate reference values. You ask how many weeks. For example, in the third week, it can be between 5 and 50, and in the fourth week, it can be between 5 and 425. In other words, HCG levels may vary from person to person. There are no sharp limits. But what happens? Your HCG level should approximately double every 3 days. So, what does it take to say that a person is pregnant? Friends, it is difficult to say this for sure in the beginning with a blood test. But let me tell you this. If your HCG level is below 5, it means there is no pregnancy at that moment. If it is above 25, then you have most likely started to become pregnant. If it is between 5 and 25, in this case it is a bit, we call it the gray zone, pregnancy has probably started again, but you need to see the increase. In other words, we usually expect a result above 25 to say pregnancy. What is needed to confirm pregnancy for sure? Your doctor will perform an ultrasound. When your HCG level reaches approximately 1000 to 2000, the gestational sac will now appear and it is definitely said that you are pregnant or not. Yes, now let's move on to the results, friends. For example, this patient took a pregnancy test and the HCG result was 0.5. What does this mean? Since it is less than 5, there is no pregnancy, which means it is negative. Let's move on to another result. Look, this is a very common result. The HCG level is lower than 1.2, usually depending on the kits. The device gives such a result. This result means there is no pregnancy, it means negative. It is already less than 5 and depending on the kits, it is usually smaller. Results like 1.2 come, and there is no pregnancy in this person either. Let's move on to another conclusion. Look friends, here is the HCG result. Beta HCG result is 24. What did I say? Gray zone between 5 to 25. This person is probably pregnant, but it would be appropriate for the person to repeat this test after 2 to 3 days, to see the increase. Pregnancy has probably started. If it is over 25, we can say that pregnancy has started. Look at another patient. What is the result here, friends? You see, it is 60.3, which means that the pregnancy has already started since it is greater than 25. Now, you also have questions like, should I repeat the pregnancy test? If the pregnancy test is between 5 and 25, repeat this after 2 to 3 days. If it is greater than 25, there is no need to repeat this. It means that pregnancy has already started, but if you have bleeding, severe abdominal pain, cramps, or have a history of miscarriage before, then you can repeat your pregnancy test to prevent a miscarriage during pregnancy. And finally, let me say this, friends, let's say your HCG levels are higher than normal, that is, your HCG level is extremely high. For example, you're 3 weeks pregnant. Let's say your third week HCG value is 125. These high values are usually either due to incorrect calculation of the gestational week or a condition called molar pregnancy. It is caused by the situation. Multiple pregnancies can also cause this. Low pregnancy hormone levels may also be caused by miscalculation of the gestational age, miscarriage, or ectopic pregnancy, or chemical pregnancy. Yes friends, this is how your HCG result is evaluated. In summary, if it is less than 5, it is negative. Between 5 and 25, there is a high probability of pregnancy, but repeat your test after 2 to 3 days to see the increase. If it is greater than 25, we say pregnancy has started. If you have any questions about these, you can ask them below the video. Do not hesitate. Let's see you in another video. Friends, take care of yourself. Goodbye.